So now we've put her on the sideline position. You want to make sure and have a cervical pillow, or have her cervical supported, a pillow here for her to be able to hug, and a pillow between her knee. But I love, this is actually my favorite position, sideline, because you can really, everything we've worked on, you know, while we were supine, you know, her abdominals and the psoas and the serratus, we can get from the sideline. So I like to start with a little bit of oscillation here, just kind of doing some skin rolling. You can go all the way up to the shoulder, but just really loosening up some of these tissues here, even though I've already worked on her supine. So we're gonna just warm up the tissues a little bit. I don't have any oil on my hands at all because she's got a lot of, I usually do skin rolling and myofascial release without any oil in my hands. So after you've warmed up the tissues a little bit, I'm going to ask her to put her hand over her shoulder, and I would just glide, you know, from here all the way up. Let's pretend that, you know, that there's no clothing on, and I would just glide from the ilium all the way up. This is a nice glide, you know, to get some things loosened up here. And I can also go from this side and just do a little bit of traction here. Support the elbow. You always want to support the elbow and just do a little bit of traction from this side all the way. Just, you might want to do this a couple of times, 2 or 3 times. Then you put always assist the arm back and hold at the elbow. So now another thing that, you know, I'm going to start with now is from this area. Now I'm going to apply oil, and I'm going to start from her, you know, from her ribs. Remember right here, the origin of the Serratus Anterior is on the 8 to 9 ribs. So kind of like these, my 8 fingers are somewhat over the Serratus Anterior. So this would be a great place for you to rake over and do some specific work. You know, go over, and remember it inserts on the anterior part of the medial border of the scapula. So it goes on the anterior part. Where's bones here? Let's get bones here to show you guys the Serratus Anterior. It always helps to have him. So Serratus Anterior originates from ribs, you know, 1 through 8 or 9 around here, and look, and it inserts on the anterior part of the scapula. So it's on the anterior part. So the serratus goes all of this here. It's the one that looks like a serrated knife. So you want to get that muscle and work on all the little, you know, like if you don't have a bevel toolbar, just use your fingertips. And if, you know, you can do one little section at a time, or you can rake. I like to do both to really be thorough here. So I will do both. This is a perfect sideline. It's a perfect way to be able to get to the serratus anterior. And I like to do some heavy lifting. And if your client's not wearing a sports bra, then you can just cover them, you know, with a sheet really good. Or you can do it over the sheet. That's the beauty. Medical massage you can do with clothes on. I do a combination between medical, neuromuscular, you know, and in clinical massage. So I just like to combine all 3. So now that I'm here, I want to go over the intercostals and then also the obliques. This is a great way to kind of rake across cross fiber on the obliques. So I can go find her belly button and about 2 inches out, because you don't want to go on the rectus. I mean, not that you don't want to go on the rectus abdominis, but you know, the rectus abdominis is more towards the middle, so about 2 inches out, and all I'm doing is just raking the obliques from the sideline position, because now gravity has pulled everything towards the table, and this is really nice and loose, and I like to work the obliques from this position. And again, here's her rib cage. I like to go around all of her rib cage and see if I can get underneath to that. Again, right here, I would be trying to get to the diaphragm. and the spleen and the pancreas on this side, because she's on this side. I'm on her left side. So, and again, this is another perfect way to get to the iliacus, because I'm cupping on the anterior part, and this is where she's ticklish, so I don't know if she's gonna let me, but I'm going on the anterior part here of the iliacus to get to the iliacus here. So you can get it from the sideline position after you've worked all the obliques. You get to this area here. And another thing that you can do is with my right hand, I'm going right, cupping right over the ilium. And then with my left hand, I'm pushing, or with my forearm, I'm pushing her hip forward so that my hands, you know, is doing this. It's kind of just helping myself a little bit, that I can push her hip into my finger pads, so I can really get to the iliacus and treat that. Because when I'm doing it like this, her hip is moving. So I'm kind of going to hold her hip steady right here. And I could have her, you know, like also move her just for an active motion. I can have her lift her, you know, like bend her leg and then put it back down and then lift it again. Like do that 2 or 3 times until I feel that I'm right on it. Okay, I'm on it right there. And then I can, that's an active motion there, and it really will help release the psoas, the iliopsoas. So this is a great way to get, another way to get to the same, and you can get to the same trigger points. If she had trigger points, now you're treating them from the sideline position. So you're treating them again. And another muscle that I love to work on from the sideline is the QL. The QL you can really access from the top here. You know, it originates, remember it originates here. We only have like a 2-inch gap in between here. There's only like a 2-inch gap. So, you know, if you want to separate, do a little bit of separation here. Because, you know, from sitting down, we're always like bending forward and there's not enough space here. So a lot of times, even the floating ribs start touching the ilium on some people. So you might want to do just a little bit of separation here. With my right hand, I'm just pushing up a little bit superiorly, and then with this one, I'm cupping the ilium and pulling it down, and then pushing up with this. And you need to be careful. Be careful here with the floating ribs. But this is a great area, a great way to treat the QL from this side. So I can push down if you use your thumbs, and if you don't use your thumbs, you can use, you know, this trigger point one. It's like I'm pushing towards the table, going down in that little area, right in the belly of the muscle between the ilium and the floating rib, and about 1 inch out. That's where one of the major trigger points is for the Quadratus Lumborum, and this one really triggers a lot of back pain, low back pain more specifically. So you can treat that there. You can hold it anywhere from 8 to 12 seconds. If it's acute or if it's chronic, then you might want to hold it up to 30 seconds, which I don't recommend. I recommend 20, and then just come back and treat it. Go somewhere else and treat it later. You don't want to activate the nervous system and have the nervous system to start releasing endorphins, because then what you want to do is retrain the muscles without pain. You don't want to create more pain, because then that defeats the purpose. So anyway, you can treat the QL. You can also treat, you know, the iliocostalis, the longissimus, and the spinalis, the erector spinae. You can also do long strokes from here all the way up, because she's on the sideline position. And obviously, you would turn her to the other side too. So you can also treat the erector spinae from this side, which if you start laterally, that's the iliocostalis. If you go a couple of inches to the midline, that's the longissimus. You glide a couple of times or 3 times. And then if you get real close to by the transverse processes, then that would be the spinalis. So you're treating the erector spinae that I love spinach, iliocostalis, longissimus, and spinalis. You can also treat the rotors and multifidi from here, which I would use my bevel tool again and just go up on the laminar groove. I'm treating the laminar groove and I'm scooping in and out, lifting, moving half an inch and scooping the laminar groove all the way up. This is another way. And like I said, if you don't have the tool, then you can just use your finger pads, like you're pushing out away. You're pushing the muscles away. I'm doing this, like piggyback. I'm pushing away from the spinous processes. I'm not on the spinous processes though. I'm right next to them and I'm pushing out, and you can go all the way up, treating it all the way up to C7. So this is a perfect way to get to all of these, the same muscles that we treated in the supine position and that we treated, some of them we're going to treat on the prone position, but this is, you know, I love the sideline position actually. It's my favorite because you can really access muscles a much better way. With her elbow pointing up and you're holding her arm, with this hand I'm going to go underneath the pec major, and you can remember that the pec major is the one that forms the anterior axilla. So I go about the third, fourth rib, go down underneath the pec major, and I just put my finger pads in there, and now I'm on the pec minor, and as I lay her arm down, my hand goes with it, and I am right on a major trigger point from the pec minor. And this is all I did. So you have their elbow pointing up, and then you go behind the pec major. You, like the third, fourth, fifth rib, there's a major trigger point on the fifth rib, and then my hand is going, you know, my hand is going when I let her arm go. So I'm right on the anterior part, and I'm on that fifth, like around the third, fourth or fifth rib, and you know, I just hold that if people have a major trigger point there. And of course, if you're, you know, if you're here, I just keep going. It's okay. The supraspinatus, infraspinatus, teres major, teres minor. You can work all of this here, but that was part of the other lesson. So I'll stick with the thorax. The thorax will be from here to here, and hopefully this gives you lots of techniques, you know, to treat your client. People that have COPD, that have problems breathing, that have asthma, or that have, you know, problems. Oh, another one that I forgot to do is, like, I put my forearm here on the ilium, and then I push, or you can do it, you know, this way too. And you can do it, I think I showed that, where you do it over her shoulder, and you can create some space. We don't have enough space here. You know, people are really hunched over all the time. We sit down most of the time. So create some space. And here at the QL, you know, your hypothenar can go right here where the QL is, and just do some friction there, you know, or get in there with your hypothenar and just do a little bit of friction there. But these are some techniques that you can take with you and use some more tools in your toolbox to help clients. So I hope you enjoyed this video.